Have you ever woken up in the middle of the night with your heart pounding so hard it feels like it's trying to escape your chest? Or maybe you've felt that persistent throbbing in your temples that no amount of pain relievers seems to touch. For nearly half of all American adults living with high blood pressure, these frightening moments aren't just occasional inconveniences, they're warning signs from a body under constant, dangerous stress. I've spent years working with patients just like you, watching them shuffle into my office with bags full of prescription medications, yet still fighting daily battles with their blood pressure numbers. The fear in their eyes is always the same. What happens when these pills stop working? Or what about these side effects that are making me feel worse than the high blood pressure itself? The truth about hypertension is far more complex than what most doctors have time to explain during your typical 15-minute appointment. High blood pressure isn't just a number on a machine. It's a sign that the delicate balance of your cardiovascular system is being disrupted by forces that many conventional medical approaches fail to address. Every time your heart beats against narrowed, inflexible arteries, it's creating microscopic damage throughout your body, to your brain, your kidneys, your eyes, and your heart itself. By the time most people receive their diagnosis, this damage has often been accumulating silently for years. It's no wonder hypertension has earned its ominous nickname, the silent killer. What frustrates me most is seeing patients trapped in a cycle of increasing medication dosages, multiplying side effects, and worsening health outcomes despite their faithful adherence to conventional treatments. The reality is that while blood pressure medications can be life-saving tools, they're often prescribed without addressing the underlying causes of hypertension. It's like putting a bandage on a wound without removing the splinter that caused it. Temporary relief, but not true healing. After working with thousands of patients and studying the latest research on natural approaches to cardiovascular health, I've discovered that there are powerful, scientifically validated strategies that can transform your relationship with blood pressure. Strategies that work with your body's innate healing systems rather than simply forcing a chemical change.
Today, I'm going to share with you 7 natural, powerful approaches that have helped my patients reduce or even eliminate their need for blood pressure medications. These aren't quick fixes or miracle cures. They're sustainable lifestyle changes based on both ancient wisdom and cutting-edge nutritional science that address the root causes of hypertension. Imagine waking up each morning with boundless energy, no longer feeling the weight of medication side effects. Picture yourself enjoying activities with your grandchildren without constantly worrying about your blood pressure spiking. Envision a life where checking your pressure becomes a confirmation of your health rather than a source of anxiety. This transformation is possible, and it starts with understanding that your body was designed to maintain healthy blood pressure naturally when given the right tools. Before we dive deeper, I'd love to know if you or someone you love struggles with high blood pressure. Share your experience in the comments below. What treatments have you tried? What's been your biggest challenge in managing your blood pressure? Your story might be exactly what someone else needs to hear today to find hope. And don't forget to subscribe to our channel and hit that notification bell so you'll be the first to know when we release new information about natural approaches to common health concerns. Now, let's get to the heart of the matter. Did you know that the foods you eat every day can be either your strongest allies or your worst enemies in the battle against hypertension? Most doctors will tell you to reduce sodium, but very few explain the critical importance of increasing your intake of 3 specific minerals that work together to regulate healthy blood pressure. Potassium, magnesium, and calcium form a powerful trio that helps relax blood vessel walls, improve blood flow, and balance body fluids. Yet most Americans are seriously deficient in at least one of these crucial nutrients. The standard American diet, with its emphasis on processed foods, has created a dangerous imbalance: too much sodium and far too little of these protective minerals. The research is clear. Populations that consume diets rich in these minerals experience significantly lower rates of hypertension. In fact, the groundbreaking DASH studies, Dietary Approaches to Stop Hypertension, demonstrated that simply increasing intake of these minerals through food could lower blood pressure as effectively as some medications, particularly in those with mild to moderate hypertension. What's even more remarkable is how quickly these dietary changes can make a difference. Many of my patients see measurable improvements in their blood pressure within just 2 weeks of making these simple but powerful shifts in their eating habits.
Let's start with potassium, perhaps the most critical mineral for healthy blood pressure. Potassium works directly against sodium's effects, helping your kidneys eliminate excess sodium through your urine and easing tension in your blood vessel walls. A recent meta-analysis found that increasing potassium intake by just 1,500 milligrams per day can lower systolic blood pressure by an average of 4.7 millimeters of mercury and diastolic by 3.5 millimeters of mercury in people with hypertension. That's comparable to the effect of some prescription medications, but without the side effects. So where can you find this blood pressure-lowering superstar? While bananas might be the first food that comes to mind, they're actually not the richest source of potassium. Sweet potatoes contain nearly twice the potassium of a banana, providing about 950 milligrams in just one medium potato. Avocados are another potassium powerhouse, delivering about 1,000 milligrams in a single fruit, along with healthy monounsaturated fats that further support heart health. Spinach and other dark leafy greens aren't just rich in potassium, they're also packed with nitrates that help dilate blood vessels and improve blood flow. White beans and other legumes deserve special mention as they're not only rich in potassium, but also provide substantial amounts of magnesium and calcium, the other two minerals critical for blood pressure regulation. Now, let's talk about magnesium, the often overlooked mineral that plays a crucial role in regulating blood vessel tone and heart rhythm. Research shows that magnesium helps relax the smooth muscles in your arterial walls, allowing them to dilate and reduce resistance to blood flow. A clinical trial found that magnesium supplementation of 300 milligrams daily for just 1 month reduced systolic blood pressure by 5.6 millimeters of mercury and diastolic by 2.8 millimeters of mercury in adults with mild hypertension. Yet despite its importance, studies suggest that nearly 68% of Americans don't get enough magnesium in their diets. Dark chocolate lovers, rejoice! High-quality dark chocolate, at least 70% cacao, is one of the most delicious sources of magnesium, providing about 65 milligrams in a 1-ounce serving, along with flavanols that help improve blood vessel function. Pumpkin seeds are even more impressive, offering about 150 milligrams of magnesium in just a quarter cup. Spinach appears again on our list, as it's not only rich in potassium, but also provides about 150 milligrams of magnesium per cooked cup. Almonds and other nuts are similarly dual-purpose foods, providing both potassium and magnesium, along with healthy fats and fiber.
Calcium completes our mineral trio, working synergistically with potassium and magnesium to regulate blood pressure. While dairy products are well-known calcium sources, they're not your only options. Sardines with bones provide about 350 milligrams of calcium per 3-ounce serving, along with omega-3 fatty acids. Collard greens offer about 270 milligrams of calcium per cooked cup, and they're also rich in potassium and magnesium. Tofu made with calcium sulfate can provide up to 860 milligrams of calcium per half cup, making it an excellent choice for plant-based eaters. But here's an important caveat that many people miss. These minerals work together as a team, and their effectiveness depends on proper balance. This is why it's far better to obtain these nutrients from whole foods rather than isolated supplements whenever possible. Whole foods provide these minerals in natural ratios, along with other beneficial compounds that support their absorption and function. I want to take a moment to ask something important. When was the last time anyone truly listened to your concerns about managing high blood pressure? Not just the numbers on your chart, but how it affects your daily life, the worry that accompanies each heartbeat, the limitations it places on your activities, the fears about what it might mean for your future. So many of my patients tell me they feel isolated in their struggle, as if no one really understands the weight they carry every day. If you're feeling this way too, I'd love to hear your story in the comments. Something as simple as, "I've been dealing with hypertension for X years, and what troubles me most is," can be incredibly cathartic. Not only does sharing help me create content that directly addresses your needs, but it also shows others that they're not alone in this journey. Now, let's continue exploring how we can transform your relationship with blood pressure naturally. Beyond these mineral-rich foods, the DASH eating pattern emphasizes several other dietary strategies that have proven remarkably effective for lowering blood pressure. First, it recommends significantly increasing your intake of fruits and vegetables, aiming for 8 to 10 servings daily. The DASH approach also emphasizes whole grains over refined carbohydrates. Whole grains retain their fiber, which helps reduce cholesterol levels and improves insulin sensitivity, both factors that affect blood pressure. Reducing added sugar is another crucial aspect that many people overlook. Research has shown that high sugar intake, particularly from sugar-sweetened beverages, is independently associated with elevated blood pressure regardless of any resulting weight gain. Our second powerful strategy for naturally lowering blood pressure involves targeted physical activity. While any form of regular exercise is beneficial for cardiovascular health, research has identified specific types that are particularly effective for lowering blood pressure. Aerobic exercise is the foundation, with studies showing that 30 minutes of moderate intensity activity most days of the week can lower systolic blood pressure by 5 to 8 millimeters of mercury. This reduction is comparable to what many people achieve with a single blood pressure medication, but with numerous additional health benefits rather than side effects.
Walking is perhaps the most accessible form of aerobic exercise, requiring no special equipment beyond a good pair of shoes. A brisk 30-minute walk 5 days weekly has been shown to significantly reduce blood pressure in numerous studies. Swimming deserves special mention for those with joint issues or excess weight that makes impact exercise uncomfortable. The buoyancy of water reduces stress on joints while providing resistance that strengthens muscles. Additionally, the hydrostatic pressure of water against your body actually helps improve circulation and reduce blood pressure. While aerobic exercise forms the foundation of blood pressure management, emerging research suggests that isometric exercises may be even more effective for specifically targeting hypertension. Isometric exercises involve contracting muscles without moving joints. Think wall sits, planks, or hand grip exercises. A meta-analysis found that isometric resistance training reduced systolic blood pressure by an average of 8.5 millimeters of mercury, more than typical aerobic or dynamic resistance training. One of the simplest forms of isometric exercise is a hand grip strengthener, used for 2 minutes at a time, with 1 to 2 minute rest periods, repeated 3 to 4 times several days per week. This seemingly minor activity, which can be done while watching television, has been shown to lower systolic blood pressure by 8 to 10 millimeters of mercury over 8 to 12 weeks. Our third strategy addresses what might be the most overlooked factor in blood pressure regulation: chronic stress. When you experience stress, your body releases hormones like cortisol and adrenaline that temporarily raise blood pressure by increasing heart rate and constricting blood vessels. While this response is designed to help us handle acute threats, chronic activation of the stress response keeps blood pressure elevated and eventually damages blood vessels. Research has shown that chronic psychological stress is independently associated with hypertension development, even after accounting for other risk factors. Mindfulness meditation has emerged as one of the most effective stress management techniques for lowering blood pressure. A recent meta-analysis found that regular mindfulness practice reduced systolic blood pressure by an average of 5.8 millimeters of mercury and diastolic by 3.8 millimeters in people with hypertension. The practice works by reducing activity in the sympathetic nervous system, the fight or flight branch, while increasing activity in the parasympathetic or rest and digest branch. Even just 10 to 15 minutes of daily meditation can produce measurable benefits for blood pressure.
Deep breathing exercises provide another accessible way to activate the parasympathetic nervous system and lower blood pressure in the moment. The 4-7-8 technique has shown particular promise. Inhale quietly through your nose for 4 seconds. Hold your breath for 7 seconds, then exhale completely through your mouth for 8 seconds. Repeating this cycle just 4 times, twice daily, has been shown to reduce blood pressure by acting directly on the automatic nervous system. Many of my patients report that this simple practice helps them manage stressful situations that would normally spike their blood pressure. Our fourth strategy focuses on an often overlooked aspect of cardiovascular health: restorative sleep. Poor sleep quality and insufficient sleep duration are independently associated with increased blood pressure and risk of hypertension development. Research shows that regularly sleeping less than 7 hours per night increases hypertension risk by 20%, while chronic insomnia raises the risk by nearly 300%. During normal sleep, your blood pressure naturally drops by 10 to 20%, a phenomenon known as nocturnal dipping. People who don't experience this nighttime dip due to sleep disturbances face significantly higher risks of cardiovascular events. Creating a consistent sleep schedule is perhaps the most fundamental sleep hygiene practice for blood pressure management. Going to bed and waking at approximately the same times each day helps regulate your circadian rhythm, which governs numerous physiological processes, including blood pressure fluctuations. Managing sleep apnea is critical for those affected by this condition. Obstructive sleep apnea causes repeated breathing interruptions during sleep, each triggering a surge in stress hormones and blood pressure. It's estimated that over 50% of people with resistant hypertension have undiagnosed sleep apnea. If you snore loudly, wake gasping for breath, or feel excessively tired despite adequate sleep time, talk to your doctor about being evaluated for sleep apnea. Our fifth strategy addresses what might be the most powerful natural intervention of all: weight management. The relationship between excess weight and blood pressure is so strong that it's estimated that up to 78% of hypertension in men and 65% in women can be directly attributed to excess body fat. Research consistently shows that for many people, losing just 5 to 10% of body weight can lower systolic blood pressure by 5 to 20 millimeters mercury, an effect comparable to taking multiple blood pressure medications. Rather than focusing on restrictive dieting, which rarely produces sustainable results, I encourage my patients to adopt an eating pattern centered around whole, minimally processed foods. The DASH and Mediterranean dietary patterns not only directly lower blood pressure through their mineral content, but also support healthy weight management. These approaches emphasize foods with high nutritional value and lower caloric density, allowing you to feel satisfied while naturally consuming fewer calories. Our sixth strategy involves specific supplements that have shown promise for supporting healthy blood pressure. While food should always form the foundation of your approach, certain supplements can provide therapeutic doses of beneficial compounds that would be difficult to obtain from diet alone. Aged garlic extract stands out for its impressive research backing. A meta-analysis found that it reduced systolic blood pressure by an average of 8.3 millimeters of mercury and diastolic by 5.5 millimeters of mercury in people with hypertension. Omega-3 fatty acids, particularly EPA and DHA from fish oil, support healthy blood pressure through multiple mechanisms. Coenzyme Q10, or CoQ10, is a vitamin-like substance involved in energy production in all cells, particularly those with high energy demands like heart muscle cells. A meta-analysis found that CoQ10 supplementation reduced systolic blood pressure by an average of 11 millimeters of mercury and diastolic by 7 millimeters of mercury after 4 to 12 weeks. Our seventh and final strategy focuses on lifestyle habits that can either support or undermine your blood pressure management efforts. Moderating alcohol consumption is essential, as even light drinking can raise blood pressure in some individuals. Smoking and nicotine exposure in any form have both immediate and long-term effects on blood pressure. Each cigarette temporarily raises blood pressure, while long-term smoking damages blood vessels, reducing their elasticity. Sodium reduction remains important, especially for the approximately 60% of people with hypertension who are salt-sensitive. Hydration status influences blood pressure in complex ways. When you're dehydrated, your blood becomes more concentrated, potentially increasing its pressure against arterial walls. Sunlight exposure affects blood pressure through its role in vitamin D production and other mechanisms. UVB radiation from sunlight triggers the release of nitric oxide from skin stores, leading to immediate blood vessel dilation and temporary reductions in blood pressure. Sauna use has emerged as another powerful lifestyle practice for blood pressure management. The intense heat exposure causes vasodilation throughout the body, effectively giving your cardiovascular system a workout similar to moderate exercise. Now, I want to address something that many doctors won't tell you about blood pressure medications. While these drugs can be life-saving tools for managing dangerously high blood pressure, they all come with potential side effects and limitations. What's more concerning is that medications address the symptom, elevated pressure, without necessarily treating the underlying causes of hypertension. This is why many people find they need increasing dosages or additional medications over time. That said, I want to be absolutely clear. Never stop taking prescribed blood pressure medications without working closely with your healthcare provider.
For many of my patients, the ideal approach is a thoughtful combination of natural strategies alongside carefully monitored medication. As the lifestyle and dietary changes begin to address the root causes, many find they can work with their doctors to gradually reduce medication dosages while maintaining healthy blood pressure levels. The natural approaches we've discussed don't just lower numbers on a monitor. They improve the overall health of your cardiovascular system, resulting in better energy, clearer thinking, and reduced risk of heart attack, stroke, and kidney disease. If you've reached this point in our conversation, you probably understand the challenges of living with high blood pressure all too well. I want you to know that you're not alone in this journey. Every day in my practice, I work with people just like you who are seeking better solutions than simply adding another prescription to their regimen. Our channel was created specifically to support this community, people who want to take an active role in their health rather than simply outsourcing it to a healthcare system that often lacks the time or resources to address root causes. Each week, we share new research, practical strategies, and success stories from others who have transformed their relationship with blood pressure naturally. If the information I've shared today resonated with you, please consider subscribing to our channel and activating notifications. That way, you'll never miss our discussions about natural approaches to common health challenges that conventional medicine often struggles to address completely. Remember that your heart beats about 100,000 times every day, faithfully moving blood through roughly 60,000 miles of blood vessels. Each healthy choice you make supports this remarkable system that has been working for you since before you were born. High blood pressure isn't your identity or your destiny. It's simply information from your body that certain systems need better support. By addressing the root causes rather than just suppressing the symptom, you're not just managing hypertension, you're creating the foundation for vital, energetic health for years to come. Your heart has been taking care of you your entire life. With these natural strategies, you can return the favor, providing it with exactly what it needs to serve you well for many more years. Thank you for joining me today, and I look forward to continuing this important conversation in the comments and in future videos.